This is Mile High.
Do I want to tell the story or do I want to show the message?
You've got a lot of work to do between Mile High.
The time has come where we can know
we have a responsibility, an ethical and moral responsibility.
We have to do it better in order to move people along.
Up, down, inside out.
If you get your mind right, it is not. It is a receiver of thought. This love is my first technique.
it's now time for the show.
Welcome to the Mile High Podcast. This is your host, Dr. Daniel Knowles. Thank you for joining us from whatever altitude you are at. We're 5,280 feet, where we anticipate you will be from Mile High 14. Wherever you are watching or listening to this, be sure to hit subscribe so you never miss any Mile High tech. So whether it be on Spotify or iTunes or YouTube, wherever podcasts are viewed, make sure you hit subscribe. We look forward to seeing you on higher ground. You can get all the details at riseuptomilehigh.com. August 20th for Mile High 14. And our guest today, Sarah Hock, will be joining us not only in the podcast, but live at altitude. She's a chiropractor, she's an educator, she's a researcher at Sherman College, where she serves as the chair of pediatrics and perinatal care. She teaches, mentors in the clinic, and leads research focused on pediatric and neurodevelopment outcomes. And she practices because she just, doesn't have enough to do. So thank you for taking time to join us today, Dr. Sarah. We're really grateful to get this time with you today.
Yeah, thank you so much for having me.
And so you're busy at Sherman College, it looks like. Yeah,
absolutely. Center of the chiropractic universe.
That is true. That's what I hear, apparently. So now, how did you end up? At some point, you weren't at the center of the chiropractic universe, but you went to school there. So what gravitational force brought you to Sherman College?
I think it's an interesting story. I was a biochemist before I became a chiropractor, and I had gotten into med school to be a medical examiner. And I took a year off because I wasn't feeling it in my heart that that's what I wanted to do. My ex was like, hey, have you thought about chiropractic? He actually saw Dr. Ron at the time, Dr. Ron Castellucci. So small world. And I went to visit Sherman, and I just fell in love with the philosophy. I sat in on one of Dr. Deccan's classes during my tour and applied before I left that day and started a month later.
Wow. Yeah. Okay, so this was like a comet towards the center of the chiropractic universe.
Yeah. It happened fast. And I never looked back. I've loved it.
Good. Well, that's exciting. So does that mean you didn't have much of a chiropractic experience before enrolling?
Yeah, I had maybe been adjusted or checked once ever post a car accident. But other than that, I didn't know anything about chiropractic. I just sat in on that philosophy class, and I was like, oh, well, this takes all the biochemistry stuff and puts it with all the life stuff and just meshes it to where it made sense.
Cool. Well, awesome. So then you got a few adjustments before school, but then you ended up getting to really dive into chiropractic philosophy, and also, I'm assuming, receiving care at that point.
Yeah,
more so. Did you have your first chiropractic intern? Was that what it was?
I did. I actually am good friends with my first chiropractic intern. So.
Well, good. So what made the philosophy that you heard at Sherman tick for you? No pun intended.
Yeah. So it's funny. A lot of people think like when you're in heavy science that you just follow the science and that allopathic model. But really what I felt was when I had studied biochemistry, a lot of what I knew was like the body was really smart and it knew how to do these amazing things. And chiropractic just really put that in a perspective that was easy for me to understand and easy for me to help other people understand.
Very cool. Very cool. So then, was there a particular thing in class where the chiropractic philosophy brought you to a new, clicked in more?
I would love to say it was the biochemistry classes at Sherman, but it wasn't. It was really the philosophy classes. I just love the philosophy classes. Really, when I got into those higher level ones, especially the subluxation theory classes, which I think Dr. Deccan still teaches at the college.
He taught it when I was there, so.
And it's a hard class, but I really liked the theoretical parts of it because I was such a heavy science person that theoretical part really made the researcher in me really excited and made me want to delve deeper into that.
Well, that's cool. Now, actually, you said the word researcher. I'm going to take a little pivot for a second, which is you said you had something got published today.
Yes, I had a case study with Dr. Hannah Layden, published this morning, was released this morning. Yeah.
Tell us a little bit about that.
It is a case study on a child that had Tourette's and OCD and the improvement they saw with chiropractic care.
Wow, that's pretty cool. Where was she? Where was the child
Dr.
getting
Hannah
care?
Layden. The
Okay.
child was with care with Dr. Hannah Layden, and she works at Spolster Family Chiropractic in Idaho.
Can you tell us any more about the case or the changes that happened?
Yeah, so really we're coming from a child that is super dysregulated, can't function with his family, can't function in school, to a child who can have even daily changes in his routine now and function with those daily changes, which as a parent, that rigidity, not having that anymore is a game changer when you have kids.
That's
So
true.
really exciting stuff. And his compulsive behaviors, Tourette's, his tics decrease, all of that started to go away, started to get better.
Well, this probably maybe will fade into what I wanted to ask you, which is what led you to focus your career on pediatrics and family care within chiropractic?
Yeah, so I graduated from Sherman. I had a family practice when I was full-time practicing, and I loved caring for families. I had a lot of moms that came in with their kids and they were pregnant, and it kind of snowballed. My mother would say I needed more maternal energy in my life, and that's what happened. I think I just liked that demographic. And I
Okay.
think the cool thing about taking care of kids is you see the changes so quickly. For adults, sometimes they have those layers of stress and years and years and years of stuff. And it takes a little while to really see those improvements. With kids, that you see that breath change, that calmness almost instantly. That's so rewarding. And I just felt like I wanted to spend time doing that and seeing that really fast.
Well, that's very cool. In teaching students about pediatrics, what do you find gets exciting about that?
I think there's two sides. One, when they're in the classroom part of it, they really gravitate to the the lens of really understanding how a child develops and how that relates to their nervous system. And that's kind of cool to see them start getting that. In the clinic side, because I work on both edges, is that watching them give their first adjustment and seeing that change in the child right away, their face is just, they're so excited. They're like, did you see that? Did you see their breath? Did you see their body relax? I'm like, yeah, I saw all of it. They're so excited by it.
Uh-huh. That's cool. That's cool. And with that, so you see what you got gravitated to, what excited you, see excitement in students for that. Is it sometimes challenging to see that relative to the chiropractic profession as a whole, how little it may focus on kids?
Yeah, I mean, I feel like the area of pediatrics and perinatal care is really growing within chiropractic. And more because people love to see those changes, and it's fun to play with kids and have kids in your office and have new babies born. Like no one dislikes that. I would say I will never turn down holding a baby. So if you see me somewhere and you're like, I want to hold my baby, I'm gonna say yes. Um, but also in that, I think that it's an area just across the world where people are just starting to say we need to take better care of future generations. And so I think that's what makes it super important. And really that push, even for me, but for chiropractic in general, is yes, we take care of adults. And I think it's important for us to be regulated and us to be adaptable. But we also have to make sure that future generations don't get to where we are and not be adaptable and resilient, because the world is stressful.
You think so?
Yeah. Yeah, I have two kids myself. So yeah.
Well, here's the thing that often there are segments of our profession as a whole that don't want you to take care of kids if they don't have symptoms. In other words, there has to be that don't necessarily see vertebral subluxations as a problem in and of themselves as a detriment to health. So sadly, there's parts of the profession in the world that sees that. How do you help people realize that that actually is quite important?
I think what their view is is what are you measuring to say that they don't have a symptom or there's not something going on with their nervous system? Because I love research, I've been really focused on outcomes for a long time now. And I think kids are one of those realms where people are like, well, they can't tell you that it hurts. They can't, show you that this is bothering them. But in reality, their behavior, the way that they move their body, the way they hold their body, those are all outward signs of the regulation of the nervous system. So if you're looking at outcome measures to determine whether a child needs care, all you have to do is look at how they process and engage their world. And that should tell you, well, look, they're not doing a great job of that. That is an outward sign that their nervous system needs care.
Right, right. And then so often in the last couple of years, the stresses have
Yeah.
elevated, we'll
Yeah.
just say that, than 10 years ago, especially with what we experienced through 2020, the
Yeah.
use of technologies and such. Have you seen these things impact kids' nervous systems?
Yeah, I mean, absolutely. You see, it was actually an interesting thing. I was just talking to Dr. Chris Kent today about what I see as technology has really affected the nervous system and that chronic input that almost makes it hard for the nervous system to want to try to be adaptable because the other way is easier. And
Hmm.
so does it keep us from making hard decisions and doing hard things in our lives and being more resilient? Yeah, it does. And that's stressful for a developing system because you can't have stress and growth at the same time. It just doesn't happen.
Right. Right. That's exactly the same thing I'd say teaching network. So, I'd like to ask you more questions about kids, but first I want to ask you something about Sherman. Tell us what's going on at the center of the chiropractic universe. What's going on at Sherman? What's exciting you about being part of that institution?
Yeah, so Sherman has a dedicated pediatric and perinatal program. We actually have 4 core classes in our curriculum that map everything from just general like OBGYN, pediatric diagnosis that are common in our profession that we hear people say to how do you really take a great history? How do you take a great history with a parent if the child has some stuff going on? How do you do a functional exam to determine if the nervous system is functioning well? How do you look at all that stuff? To Dr. Castellucci teaches adjusting, and I mean, has been teaching adjusting for a long time. He's amazing at it. We even give our students a class on how to set care plans and home care and talk to the community and do research and, report of findings that are very specific for these populations. In just the core, we would like our students to be able to graduate and be able to take care of a 1-day old when they come into their office, be able to take care of a mom who's maybe 41 weeks and 3 days and not be scared to do stuff like that and be really confident in their skills.
Do you feel that has up leveled in the time that you've been at Sherman, the pediatric program?
Yeah, so the pediatric program just started. We had some classes and we just started the solid program in the last 3 years. Our first year running it, we increased our pediatric and perinatal patients in our clinic by 25%.
Wow.
Yeah, last year we had an increase of 22%. Last quarter, which was the beginning of this year, we had an increase of 5%. So we'll see an increase as we go through. Yeah, and we do a ton of stuff in our community. We have community partnerships. We throw community events on our campus, host baby showers, all kinds of stuff.
Wow, that's super exciting. That's super exciting. So, what are you building right now that excites you most?
Um, right now I'm sitting at about like 80% of our interns see a pediatric or perinatal patient before they graduate. I'd love to see that.
Really?
Yeah. I'd
Wow,
love to see
that's
that
great.
closer in the 90 percentages. I know
Uh-huh.
not everybody wants to take care of this population, but I think everybody deserves the chance to have an experience with this demographic because that way when they go out in a practice, it's not new. They feel confident and they feel confident in their hands and what they say and how they interact with the parents and the child.
Well, I would definitely agree that should be something that happened. Everybody experiences in chiropractic school to take care of people in multiple demographics, one of them being, infants, and obviously the other end of the age spectrum too. You need those skill sets both in the history and process and intake process, and also obviously clinically and what you do with your hands. But to see that rise is very cool. I think that's a great feather for Sherman to have in its hat to say that, for sure. And what more do you look forward as in terms of that forward growth that you're contributing to for pediatrics at Sherman?
Um, so currently I'm doing some post-grad work with Lona Cook.
Uh-huh.
And so long term, I have a great relationship with a bunch of our schools in the area. I actually serve on a school board currently. And so I would love to see us in the schools long term. Adding on to that, we're already doing a lot of outreach. And I think that's a natural progression of where we need to be going. Yeah.
Very cool. Very cool. So now, how do you help interns or new docs transition from theory into real chiropractic practice, pediatric practice?
In the clinic or when they leave?
Both.
In the clinic, so our department only has a very few clinic docs, and we manage all of the pediatric and perinatal cases. So there's a lot of one-on-one. There's a lot of sitting through visits. There are a lot of checking behind students until they really get confident in their skills. And I think that's really good to model for them and also to gain their confidence. I will tell you, majority of the time when I check behind a student, they've done a great job. They found the
Cool.
right segment, they found the right listing, the baby's been calm or the child's been having fun and playing. And I think it's a good, the more that they do it, the more experiences they have doing it, the easier it becomes.
Now, you practice chiropractic as well. You have a
I
family
do.
practice, Nest Chiropractic.
Yep.
Can you share anything about practice, real world practice, in terms of helping people create an environment for kids?
Yeah, so I actually have a home office. Only I have a lot of time at the college, and so I have two children of my own, so it's easier for me to have a home office. And I think the greatest thing about my office is I'm very community based, and so I'm referral only. But the kids that come in, they play with each other. I heavily block schedule. Parents will come in, especially new patients are always funny. They'll come in and be like, "Hey, I know you. I go to church with you, or I do this with you." And then all of a sudden, it's just a really tight community of people. And I think it's really good for students to see that you can practice in lots of different ways and make a really big impact on your community.
Have you had that experience that practice is its community within and of itself?
Oh, yeah. Yeah, for sure. It's always funny. It's actually, this is a funny story. I won't say who, but I live in a very small community, like little street, my suburb community here. One street's got 40 something houses on it. And we had a block party. And I will say about 20% of the people already knew who I was, and I had never met them because they had family members that knew me. And I just thought it was really funny.
Yeah, I mean that's one of the things that I notice in practice that it becomes its own organism, its own community, and it becomes its own vortex that people get drawn into based on the message, the voice that people are putting out from that practice. So, like when you're creating a family perinatal pediatric practice, then you attract more of that
You do.
as compared to when you put some other message out. And there's lots of different ways people practice and what they want to attract, but most certainly in pediatric practice, that's the case. Now, what are some pitfalls that you see people need to have more strengths in or run into when they're taking care of kids and need to have more better skill sets or knowledge or communication
Yeah.
skills?
I think really keeping it really simple. I tell students a lot, an overwhelmed child coming into your practice means they have an overwhelmed parent. So less choices, less decisions. Most parents have decision fatigue. They've been making decisions for themselves and their kids all day long. And by the time they get to your office, they're probably stressed and tired. And if you give them 8 things to choose from and you can do this or this or this, I think it's just too much for parents. So really pulling back and having a really simple structure, a really simple decision-making process, I think is super helpful for people when they're in practice for kids and parents.
Right, right. And how about attracting families and kids and communicating that kids need care for their spine and nerve system too?
Yeah, I think it's funny. I tell students I have a bunch of shirts that I like to wear, and I wear them to soccer a lot. And they say there are no bad kids. It is, I will say, I've gotten more patients from that shirt than I can count. I think sometimes just leading with, I understand where you're coming from. I understand you're frustrated, and I just want to support you. And I think parents don't hear people say, I want to support you very often. They
Mhm.
feel very judged on a regular basis. And I feel like if you're in a position to just provide them support, you create a level of trust that they're not getting from anybody else.
I think that's very wise advice. Now, you're going to be out to Mile High to
Yep.
present. You've never been to, have you ever attended Mile High? I don't
I
remember.
have not.
You
I'm
have
super
not.
excited.
Well, and you should be. So, and why are you excited to share and to be there?
For several reasons, I get FOMO every year when I see everybody post their stuff for Mile High, and I've always been like, I need to go, I need to go, I need to go. Um, it normally falls when I have other stuff, so it's kind of exciting that it felt perfectly this year, that I had nothing else, and I was like, we're gonna do this now and book it, so I don't have anything else the rest of the year.
Great. Great.
Um, I also love to see the speakers that come. I know a lot of the speakers that you've had, and they are just the people that when you leave seeing them speak, make you feel like one, you're in a place with family and that you're like-minded, but also make your heart feel really full that what you're doing and the passion you have for it is exactly where you need to be.
It's a very good point. It's one of the things that I didn't think of when I put together Mile High. And originally, we had a political movement that we wanted. We wanted to start a message. We wanted chiropractors to be strengthened in their knowledge relative to subluxation focused care and towards our philosophy. And then something happened that I didn't realize or didn't anticipate, but then felt very quickly, which is that people really needed community. They needed to be around other chiropractors. They needed to be able to share. They need to get out of the four walls of their office and be connected with other people that are on the mission that they are so they could feel like they're part of something. And we are part of something as chiropractors, and sometimes we can lose focus of that. So that's one of the things that what you just said spoke to that to a great degree.
Yeah.
And I think that's one of the things people say all the time when they leave. When I say, "What did you like?" They almost always say the people, being around people, the vibe, the being there. So I'm really glad that you'll get to experience and be there. Can you share anything? Maybe early for this, but do you know anything about what you're going to share on stage?
Yeah, I think really talking about how we can make that connection between those outcomes that we're looking at, those measurements with our peds patients and what that looks like when you communicate to parents and communicate to other professionals. I think we think that they're two different things, but they really are the same thing. And they're really easy to look for and easy to measure. And since I love research, I think anytime you got a measurable, it's always a good thing. They tell the story of the amazing care that you're giving your patients.
I agree. I agree. What would if you look, you've been in chiropractic world for roughly 2 decades. As you look forward, what would you like to see in the future of our profession?
Ooh, this is a good question. Right, I'm really focused on a bunch of pretty large research projects right now, so I'm kind of like in this research mindset. I would love more chiropractors to do research that shows the connection between the nervous system and all the stuff that everybody else is speaking about. I think there are lots of other professions that are speaking chiropractic right now. They're talking about the autonomic nervous system and dysfunction and sympathetic and vagal tone and all these things. And no one is stepping up and saying, but you're talking about chiropractic. And I think we need more of that happening in our profession because if we don't, someone else is going to do that.
And why do you think that's the case?
I think people for research wise, I think people are scared to do research, but sometimes people are also just scared to stand up and be the first person to say, "Hey, you're talking my language. Let's have a conversation about it."
hmm hmm Yeah, I agree, and I also think it's sad that we've put ourselves into that position as a profession because we've let ourselves be known for something which might be true, but it also is the lowest end of the gifts that we give. We give much higher gifts than something release or tension change or something popping or some pain going away. And those things happen. And, certainly that's wonderful for a person, but there's bigger gifts to what we do as chiropractors. And I think that we've settled to some degree as a profession, not, many of us haven't, but as a profession, for that lowest rung of what it is that we give, rather than people seeing the biggest gifts of what chiropractic is, and not crediting what we do for that, and not thinking that that's part of our profession.
Yeah. I think it's a great aspiration to say I would love no one to have pain. I think that's an amazing aspiration to have. I think it's a bigger aspiration to say I would love everybody to have resilient, adaptable nervous systems. The difference in society for that and that long term is a bigger impact than people not having pain.
Right, right. It's a bigger gift, right? And it's the higher order rather than the low order of what we give. Well, I really think you've taken time to be on the podcast here. I'm really thrilled that you're going to be at Mile High, and the students at Sherman are very fortunate for having you there to help them grow and help them learn more. So congratulations on your research. What more would you like to share with students or doctors that are on this before we sign off?
Yeah, I think for docs, I tell docs a lot, and I think this should always be a thing. If you're seeing miracles, amazing things happen in your office, no one knows about them if you don't write about them. You need to be publishing that. So there's more people out there seeing those amazing things that we all know we're seeing in our offices.
That's so true. And one of my mentors, Ralph Boone, said that a long time ago to me,
Yeah.
about how, we there are these things that happen, and if there's the opportunity to measure it and share it, it's the only way that we continue to let the kind of things that you've been talking here be known and related to our profession. So
Yeah.
thank you for being one of the people leading that.
Thank you so much. Yeah.
So we look forward to seeing you in Higher Ground, August 20th, 23rd. Make sure people hit subscribe so you never miss any Mile High tick. Join us. You can get all the details at riseuptomilehigh.com. You're going to want to see Dr. Sarah Hock there. And again, thank you for helping students. Thank you for helping your community. Thank you for publishing. And thank you for being a model to so many chiropractors around the world.
Thank you so much for having me. I look forward to seeing everybody up high.
Keep changing spines, lives, and minds with chiropractic.